A new first-of-its-kind report is highlighting the increased cancer risk for people in the LGBTQ+ community. This comprehensive analysis from the American Cancer Society shows that 1 million queer Americans are living with a cancer diagnosis. Those patients often have worse health outcomes, delayed diagnosis, and an increased risk for reoccurrence. The report identified a few potential causes. One is behavioral factors. LGBTQ+ individuals are slightly more likely to smoke or drink alcohol. Another big factor is fear and experiences of discrimination. Joining us now to discuss this report is Timothy Jackson, Senior Director of the AIDS Foundation Chicago, also a volunteer with the American Cancer Society. Thank you for being with us to talk about this.
Thank you so much for having me.
I want to start by talking about these barriers to health care that so many in the LGBTQ+ community face. Walk me through what those are.
Absolutely. One of the main ones is really the people in the LGBTQ+ community sit at the intersection of homophobia, stigma, discrimination, transphobia. And so really just getting into the door of a provider is really kind of a Herculean task. And so what ways can we really kind of address those issues that this community faces is really kind of one of the central tenets of this report by the American Cancer Society.
Yeah, and interesting to see it in black and white. There were references to the community possibly more likely to smoke or drink, risks including HIV that could lead to cancers. Are there specific efforts to educate with those risk factors?
Absolutely. You know, the education is so crucial in community that the American Cancer Society and many others, including AIDS Foundation Chicago, does annually. But it is really important that we hone in on other factors, such as medical mistrust, and that we, cultural competency among providers, and a host of other, issues that impact this community getting the care that they need.
Right. So what are your tips to people when they're looking for a healthcare provider so that they can be comfortable?
Absolutely. Understanding that the LGBTQ+ community leads full lives, and so to be able to go into a space where they can represent the fullness of their humanity, a provider that understands trauma-informed care, understanding that that trauma is an important asset, when we're talking about getting care for this community. And so all of these things play a tremendous part in making sure that this community gets the care they need and deserve, to be honest with you.
No doubt, yeah, no doubt you've heard this also from people that you've spoken with, but what are patients saying that they would really like to see, when they're in the exam room from their providers?
Absolutely. Providers that actually listen first. I know that sounds kind of simple and kind of rudimentary, but it is. It's just, and allow people to get out their full experience without interruption. And then understanding too that we are not a monolith. Yes, we're part of a broader community, but we are independent people. And so understanding that we're all going to have different experiences and leaning into those different experiences, I think will provide better health outcomes for the LGBTQ+ community.
Well, and this report certainly helping make that happen with the information. Timothy Jackson with the AIDS Foundation Chicago and the American Cancer Society, thank you for walking us through this important report.
Thank you so much.